We don't have a lot of details yet, but it seems to be related to vaccine-derived polio. And so what that tells us is that people who are vaccinated are likely well protected, but we're really worried about declining vaccine uptake. So there is an oral polio vaccine that's not used in the United States. It's actually used internationally that in rare circumstances can revert to a form that can cause infection. In the places where it's used, the benefits of vaccination far outweigh the risks, and anyone who is vaccinated is protected against this. But when we do see cases of vaccine-derived polio transmit, it's when vaccination coverage is low. This isn't normal. We don't want to see this. And it's really a consequence of low vaccine coverage, or lower than we'd like to see vaccine coverage. So the fact that you're hearing about this, a bit more, and there was a recent, a news story out of the United Kingdom of somewhat similar circumstances, is a consequence of our not doing a good enough job making sure everybody's vaccinated. People who haven't seen that, I don't think understand how bad of a disease it is, and just sort of assume it's something they can get over. But it is a disease that is terrible, and it was a remarkable human achievement that we developed a vaccine to protect people from it. Again, if you're vaccinated, it's not something you really have to worry about. But in communities where vaccine coverage is low, then we do worry about spread. And so this is not the first vaccine preventable illness we've actually seen in Rockland County. And just before the pandemic, there was a very large measles outbreak in Rockland County, also due to low vaccine coverage.